Hola, it's Nurse Juan Carlos. Welcome back to my channel. Well, today we're going to talk about what do actually LPNs do. There's a lot of saying that LPNs are limited, they can't do much, they can only do this. Well, it depends on what kind of setting you're in. If you're at a hospital, if you're at a clinic, if you're at a nursing home, home health, it all just depends on where you're working at. But before we get into that, make sure you hit the subscribe button, share, and like. So I wanted to take you guys with me and show you a little bit of what I do. But I didn't want to take the camera and record, because I feel like when people do that, you really don't see what people do. When, they record them getting ready in the morning, driving to work, and logging into the computer, and being in the break room or the supply room. I think those are wasted videos because people don't really see what you actually do. So I'm just gonna let you know and explain it and tell you what I do. I work at a facility for a nursing home. It's called a skill facility, a SNF facility. There's many names for it. At my facility, they have three different areas that they focus on, which is rehab. After people have surgeries or they have falls, they go there to get rehab. We have the long term, which people live there for forever. They go there to live. And we have also a skill, which is also like a long term, but they tend to get a little bit of more rehab. At my workplace, I work with doctors, with other nurses, with CNAs, with therapists. There's occupational therapy, physical therapy, speech therapy. I also work with social workers, and each job has their own description. I work the day shift, so I come in at 6:45 a.m. and clock out at 7:15. Not always it happens like that, because sometimes you gotta stay late to finish charting, or something happens, you get a late admit, you get a fall, so you gotta finish what you're doing. I work 3 days a week. So usually when I come in, I clock in at 6:45. I go on the floor, I get my assignment, and then I go to the night nurse and we count the cart. So usually you have a cart with all your medication, and you pretty much just count the narcotics, because those are the main ones. When I first started, I thought you had to count the whole cart, which I think you will be there for hours if you're counting each single pill. But the regular medications, like their blood pressure, insulin, vitamins, you don't count those. You only count the narcotics. Make sure that they're all there. After that, we do report, so they let us know what happened throughout the night or what's going on, what to look for during the daytime. So that's what we do. And then after that, I check my assignment for the CNAs who see who's working with me. A lot of nurses tend not to do that. They just go on and continue working. But I like to know who's in my team, so we can kind of catch up and say, we're going to do this, we're expecting this. Because I like to be on the same page as the CNAs. Then I go on and I start passing my medication. I log in the computer, and I usually tend to give pills to the ones that are needy, or the ones that are going to be calling right away for the medications. And usually I tend to have like 2 or 3 of those patients, and I get them out of the way and then continue smoothly, because I don't like to be rushed or like to be pressure and calling or have them be suffering or be uncomfortable waiting for their medication. So I just give it to them right away. That way they're taken care of and they're gonna have a good morning. And then I continue with my med pass. Usually the med pass lasts about 3 hours, and then by the time I'm done, it's about 10 a.m. and then I go on and continue on the computer's charting, and I follow up on some orders. I check with the doctor, I give him a report, or he'll come ask me about things that are pending or anything that he wants to relate to me. Same as me, I'll do the same with him. I'll talk to him and tell him my concerns or any problems that's going on. And then after that, I continue going on to my treatments. So we usually have different stuff for our charting. It's like the medication, the treatment, and the TARs, which are like little extra stuff. After that, I start my treatment. So people that have wound vacs or treatment on their legs or wrap or any treatments that I gotta do, mostly they're wound care related. We do have a wound nurse, but at times we have to do some of them, or we do the minimal and they do the major ones. So do that and then start getting ready for lunch at 12, do some insulin checks and do some medications. Usually the heavy medication is always in the morning. That's when you have so many pills. Everybody takes pills and everybody takes a lot of pills. So that's when you do your heavy medication pass. In the afternoon is insulin, a few pills here and there. And then after that, I go to lunch. And then after lunch, when I come back, I do some charting, chart any behaviors that happen with the residents, any changes in condition. Sometimes the doctors put orders, so I have to translate those paper orders to the computer, call the pharmacy, make sure that we have everything set up. And then we also have a checklist within our unit. Each unit has one. You have to make sure that you check the temperatures of the fridge, make sure you check this, make sure you check this, and it's just like a checkoff list that you do. And usually by then it's already 3 o'clock, 4 o'clock, and you're just charting. You chart from the moment you clock in all day long until you clock out. Just charting, because you really have to chart every detail, everything that happens with the resident, and then make comments if something happens with the medication. Everything that happens, you have to chart it. It's a thing. Sometimes you think that nurses just sit there in the chair, but we don't. We're charting because, like it says, if you don't document it, it did not happen. So then at 4 o'clock, 5 o'clock is dinner time. So you do your insulin checks before dinner, and you do a few pills, usually the last pills of your shift, if you're working a 12-hour shift. And after that, they're doing dinner, and you're finishing up and catching up on all your things that's happening. And then after that, it's already 6:45 p.m. and the next shift is coming on, and you do the same thing. You count the cart. After you count the carts, you do report, and you're done for the day. And I know it seems like, I don't know, the way I was saying it, there's these things that you do, but when you're actually working the shift, it's like so many things coming at you. Sometimes it's so hectic that you can't even have a drink of water because you're like running one thing after another, and it seems like the day is never gonna end, or you don't have enough time in the day to do all those tasks and skills. But you get a routine, and especially depending on what section you work, but pretty much you get a routine, and everything flows, as long as you're staying on top of the things and multitasking. So tasks and skills that we're able to do are pretty much a lot of things. Anything that the CNA could do, we could do them. From turning patients, changing patients, feeding patients, all the ADLs and stuff, we are able to do. As a nurse, of course, I'm able to give medication. I'm able to do observations. So when we get a new patient, I observe the patient, make sure that they're stable, listen to their heart, check their skin, everything that consists from doing an assessment and a new admission. I am able to do all of that. Give injections, start and stop a feeding tube, continue the feeding tube, set it up. One thing that a lot of people don't know, LPNs could do IVs. We could start them, stop them, continue. We're not able to do blood transfusions. We are able to start fluids. If we need to push a medication, we have to have the RN push the medication. But we are able to set up antibiotics. We are able to do fluids. There's a lot of things that we could do with IVs. Maybe like one limitation that we can do, but pretty much from what I've seen at my job, I've been working on my job for 8 months now. LPNs and RNs have a lot of the similar things that could do. I would say maybe like 1 or 2 things that they're not able to do, which is the blood transfusion, push IV medications, start an assessment. We go and observe and just give it the information. What else? We're able to pronounce when somebody passes away with another RN. We could pronounce them dead. At the end, I feel it's a team effort. Everything we do, because some things we don't have time to do that the CNAs do, just because we have so much medication to give or keep up with the charting. So some things fall on the CNAs to do, and same as us, they can come and give medication because they don't have the license for that. So I feel it's a teamwork for us to do, but also we have to help each other, just because sometimes we have short staff and the CNAs have a lot of patients to the ratio of the nurse. So we tend to work together. That way it's not a burden on the CNAs or a heavy load on the CNAs, as well for the nurses, that the nurse is picking up the slack. So it's about teamwork and communicating every single day. If you guys have any specific questions about a specific skill or duty that you're not sure if LPNs are allowed to do or we are allowed to do, just leave your question on the comment section and I'll get back to you guys. Also, if you guys have any ideas of what questions you guys want me to answer or any topics you guys want me to talk about, leave them in the comment section and I'll make a video of those. And if you guys want to hear more about my nursing experience, subscribe and hit like and share so you can be notified when my videos are up. And thank you.